Sin, co-director of Academic Medicine Education Institute. We are very privileged today to have with us Professor Bill Branch from Emory University. Professor Bill Branch is the Carter Smith Senior Professor of Medicine, and he was the past director of Division of General Medicine in Emory University for 17 years. So perhaps I'll just ask Professor Branch, why do you think it is important to incorporate humanism in healthcare and medical education?
Well, I think that we doctors more often are treating people who benefit from our efforts to make them, to relieve their suffering or prevent their suffering, than we actually cure them. I think we cure as many as possible. But medicine is really a profession about trying to help people who are suffering and make them better. And that's a very human endeavor. The doctor is actually a big part of the treatment. I mean, your relationship, the patient's belief that you're going to be with them and that you understand and care about them is one of the major ways that we make people feel better.
So in terms of education, I think it is rewarding to see that this is being incorporated and this is being delivered to the trainees and the students.
Certainly in the United States, we've been at this for a while. I've been in medicine for 50 years, and I've watched it over that time. I've seen it change and become more humanistic. Beginning around the early 1980s, we really discovered that using a small group teaching method where you learn to communicate with patients by actually practicing and getting feedback and coaching, we discovered that this was really effective and we really could teach people to communicate better. And I think ever since then we've been trying to spread this in the medical schools and the related fields, things like medical ethics, palliative care, social medicine, along with how to form a relationship with a patient.
Right, it's very important. Now, Professor Bill Branch just came from Taiwan.
Yes.
You are here in Singapore, you are going up to Hong Kong.
Yes.
Do you see there's a growing and emerging trend in the healthcare medical education internationally today?
Well, I believe there is. In Hong Kong, we are going to have a conference on patient-doctor communication, which will include people from all over the world, as many as possible. I'm not sure exactly how many countries. And we've started a charter on humanism in healthcare, which we're trying to get people to sign and endorse. And we just started this about a year ago. We have a considerable number of people already, and we hope to spread this. And I think we're being met by the sense that there's a great interest in humanism among cultures, among doctors from different cultures. In fact, you know, I think medicine itself is a unique culture.
Interesting. Here we are relentlessly in the pursuit of advanced technology, high tech, and there's a lot of things we could do, we can harness just within ourselves. Do you have any real life example where humanism or simple human touch has changed a patient's outcome?
You know, there was a recent one that created a lot of discussion where some patients with terminal cancer were divided randomly, and one group had a palliative care doctor from the very beginning that met with them, saw them frequently just to provide humanistic care and support. The others received the usual care from their cancer doctors, which was directed toward the treatment of the cancer. And both groups got that. Actually, the group that had the palliative care humanistic approach lived longer and did better. So that created a great deal of discussion. But, you know, we're very early, I think, in discovering that this may have some therapeutic benefit. I think it's basically what we do. I mean, as doctors, we're there to relieve the suffering of the patient. The technology, which I respect greatly, and I mean, I consider myself also a technical doctor. I mean, you know, I'm a diagnostician. I treat very sick people, and I try to cure them as much as I can. So I try to integrate these things. But those are my tools, my goals, what I believe in. That's all the humanism in medicine.
It's very interesting that we often downplay the power of mind and emotion in the patient's well-being.
Well, there's a tremendous benefit to the patient from feeling that someone cares about them as a person. As I was saying earlier today, it doesn't just apply to someone like me, who is a physician, a general physician. I can see people that some of them I've had as patients for 20 years or more. But even a doctor who does a procedure like an angiogram, I mean, the importance of the way that doctor treats the patient, the calmness, the kindness, the sense that the doctor is looking after you even for those 30 or 40 minutes, incredibly important. Or meeting with a surgeon for just half an hour before the operation you're going to have. People will feel that's the most important thing that they can think of, is to have that 20-minute conversation with the surgeon. So it applies across the board, even to the most technical of specialists. The patient wants to feel that the doctor cares about them as a person. They do want to have the perfect operation, of course, but they also want to be sure that someone is looking after them.
Right. I'm sure all of us will benefit from Professor Branch's sharing, and I really look forward to further development in this field. So we wish Professor Branch a very pleasant stay in Singapore and a very good trip.
Well, thank you so much.
Thank you.